Artificial intelligence doctor. User question. How might adiponectin be utilized as a diagnostic and prognostic biomarker for cardiovascular diseases? Claude AI answer. Adiponectin is a protein hormone produced by adipose tissue that has gained significant attention in cardiovascular research due to its anti-inflammatory, anti-atherogenic, and insulin-sensitizing properties. Here's an overview of how adiponectin might be utilized as a diagnostic and prognostic biomarker for cardiovascular diseases, CVD. Diagnostic applications. Risk assessment. Low levels of adiponectin have been associated with an increased risk of developing CVD. Measuring adiponectin levels could help identify individuals at higher risk for cardiovascular events. Metabolic syndrome detection. Adiponectin levels are inversely correlated with components of metabolic syndrome, including insulin resistance, hypertension, and dyslipidemia. Low adiponectin levels could serve as an early indicator of metabolic syndrome, which is a significant risk factor for CVD. Coronary artery disease, CAD, diagnosis. Studies have shown that individuals with CAD tend to have lower adiponectin levels compared to healthy controls. Adiponectin measurement could potentially be used as an additional tool in CAD diagnosis, especially in combination with other biomarkers. Atherosclerosis assessment. Adiponectin plays a protective role against atherosclerosis. Lower levels might indicate a higher likelihood of atherosclerotic plaque formation and progression. Prognostic applications. Prediction of cardiovascular events. Low adiponectin levels have been associated with an increased risk of future cardiovascular events in various populations, including those with existing CVD and apparently healthy individuals. Assessing severity and progression of CVD. Adiponectin levels might correlate with the severity of CVD. Monitoring changes in adiponectin over time could provide insights into disease progression or response to treatment. Post-event recovery. Adiponectin levels might be useful in predicting recovery outcomes after cardiovascular events such as myocardial infarction or stroke. Treatment response monitoring. Changes in adiponectin levels could potentially be used to assess the effectiveness of various cardiovascular treatments, including lifestyle interventions and pharmacological therapies. Challenges and considerations. Standardization. There's a need for standardized measurement techniques and reference ranges for adiponectin levels across different populations. Confounding factors. Adiponectin levels can be influenced by various factors such as age, gender, body mass index, and certain medications. These need to be accounted for in interpretation. Isoforms. Different isoforms of adiponectin exist, and their specific roles in CVD are still being investigated. Measuring total adiponectin versus specific isoforms might yield different results. Integration with other biomarkers. The diagnostic and prognostic value of adiponectin might be enhanced when used in combination with other established CVD biomarkers. Cost-effectiveness. The added value of adiponectin measurement in routine clinical practice needs to be balanced against its cost and availability. While adiponectin shows promise as a biomarker for CVD, more research is needed to fully establish its clinical utility. Large-scale, prospective studies are required to validate its use in different clinical scenarios and to determine the most effective ways to incorporate adiponectin measurement into cardiovascular risk assessment and management strategies.